Good evening, everybody. Welcome back to Bread and Butter Primary Care. I'm Dr. Stokes, and today we're going to talk about type 2 diabetes, common symptoms, and why they happen. So I want this video to be a review of the most common things that you'll hear patients complain about that might lead you to a diagnosis of diabetes. If you're a patient listening into these videos, these are some of the symptoms that if you're noticing you're having some of these, it might be worth going to get checked out. So we're going to talk about the 4 or 5 most common symptoms that people get with type 2 diabetes, why they happen, to help you guide your decision as to when to test and who to test. So the most common symptoms with type 2 diabetes are eating or excessive hunger, excessive thirst, excessive urination, fatigue, and edema. Now there's a host of other symptoms, but those are probably the ones that I personally hear the most and that you hear described the most. And so I like to think of the excessives, and then there's those other two. So there's excessive thirst, hunger, and urination, and then oftentimes fatigue and some swelling that can come along with that. Now, the further along someone is in diabetes, then the more types of symptoms they can have. So for example, neuropathy, numbness and tingling in the feet and extremities, worsening vision, those are also symptoms, but usually they're because of a more progressed diabetic problem rather than like on an initial presentation. However, a very high sugar can cause transient blurred vision. So sometimes if you have patients that say, I keep having this blurred vision where I'll be fine, and then one day I have horrible blurred vision, and then the next day it seems to be fine and it comes and goes, that can raise a flag that say, hey, maybe this person has diabetes, and when their sugars are really high in the 300s and 400s, they're getting sorbitol in their eyes and it's blurring the vision. If the sugar comes down, then that gets absorbed back and their vision is back to normal. So transient blurred vision is another one that we could add to that, but we'll talk about those 5 main ones for now. So excessive hunger. The reason you get excessively hungry when you have type 2 diabetes is mostly because if you actually have excessive amounts of insulin. So there's this balance in the body between glucose intake and insulin levels. If you have high amounts of insulin, then you oftentimes crave carbohydrates and food so that you can get the sugar in to balance it out. And if you have a high amount of sugar, then your body makes more insulin. Now in type 2 diabetes, we talked about in what is diabetes and why do we care, that the main problem is that your body doesn't respond to the insulin you make. And so what happens is you sometimes overmake insulin because you make the normal amount, but it doesn't really work, and so the sugar doesn't come down, and so you overproduce. And so type 2 diabetics, especially early in their presentation, will have high insulin levels. And those high insulin levels drive hunger. And so oftentimes people who have type 2 diabetes will notice that I'm just hungry all the time and I just have a voracious appetite. So that's excessive hunger. Excessive thirst. This one comes in combination with the urination. So we'll talk about excessive thirst and urination together. The reason that you have excessive amounts of urination in diabetes is because of an osmotic issue. So everyone knows that if you have a glass of water and you pour sand in the water, the level of water will rise. So if you have a glass of water that's half full and you pour half a cup of sand in there, then the level where the water is on the cup is going to be higher because the sand takes up that room. Well, if there was a membrane at the top of that water level and then you were able to put the sand in, it would put pressure on that membrane. The water would try to increase, but there was something there, it would put pressure on it. And that's kind of what happens in the body if there's a lot of solutes in the blood. And so if there's a lot of salt and sugar and that type of thing, then it puts pressure on the fluid and you end up pushing more fluid through the kidneys. So as the blood runs through the body and it goes through the kidneys, if you have a lot of sugar in there, it pushes more fluid out through the kidneys, and so then you're constantly having to urinate. So you're peeing more often, and then that is what drives the excessive thirst. And so you're dehydrating yourself because you're urinating so much, which means you're constantly thirsty. So if people are coming in and they say, I urinate way more than other people that I know, and I'm constantly thirsty. I'm drinking and drinking and drinking, and I'm peeing and I'm peeing and I'm peeing, and I'm also super hungry. Then those are all signs that you might have an increased sugar in your blood. So excessive hunger, excessive thirst, excessive urination. Edema is the same issue as really with the urination, but just in the tissues instead of the kidneys. So you've got a lot of solutes in the blood, you've got a lot of stuff. There's increased amount of osmotic pressure, and so fluid gets pushed out into places where there's lower solute concentration, and so you can get swelling in the legs. And so especially if people are coming in and they're saying, hey doc, I feel like I'm really thirsty all the time, I'm peeing all the time, and I notice that when I go to bed at night I take my socks off and there's this indentation on my leg because they've got some edema and they're having those things, then likely you're dealing with someone who may have a high sugar in their blood and maybe a diabetic. Fatigue really is just because of the overworking of the body to constantly try to chase the sugar level. And so there's this constant problem where you make insulin, but it doesn't work, so you make too much, and then you eat more than you should, and so then there's more sugar, and then it's gone, and you're just running and running and running and cranking things through, plus you're urinating more, you're a bit dehydrated, and so there's all those things kind of combined tend to make people feel tired and ill and just not well. So those are the main, most common symptoms that you'll see with diabetes, and a brief discussion as far as why we see those symptoms. So if you have people coming in, they're thirsty all the time, they're hungry all the time, they're peeing all the time, they've got some edema in their legs and they just don't feel well, then be ordering that, that fasting blood sugar or that A1C. Check them out, make sure they don't have diabetes, because you can fix that bad cycle and you can actually eliminate all those symptoms quite easily with an improvement in the sugar. Remember the blurred vision as well. If they're having really high sugars, they could be getting transient blurred vision. So I hope that's helpful. Diabetes, type 2 diabetes, common symptoms and why they happen. Have a great night.